No more senior fell down. For children, falling means crying. For young people, getting up wherever they fall. For old people, falling may mean fighting with death. In our country, falls are the leading cause of injury and death among people over 65 years old. Among people over 65 years old in my country, an average of 3 to 4 out of 10 people have fallen. The biggest impact of a fall is fractures, with the main parts being the hip joint, spine, wrist, etc. Among them, hip fracture is the most serious, also known as the last fracture in life. Its mortality rate is as high as 20% to 30%, and the disability rate is high. 42% of patients cannot regain their pre-injury activities and 35% cannot walk independently. Once this part of the elderly fractures, the survival rate after 1 year is only about 50%. That is, 1 year after a hip and proximal hip fracture, about half of older adults will leave us permanently. The traditional concept is that the elderly should avoid surgery as much as possible when they are older, and it is best to treat conservatively. However, this is not the case for older adults with hip fractures. If conservative treatment is adopted, the elderly need to be bedridden for a long time. Not only do they have to face many fatal complications, but they also bear the risk that the broken bones may not heal. Experts recommend that elderly people who can undergo surgery should not be treated conservatively. When a fracture occurs, it is not just the bones that are injured. The femur cannot heal. The person has to stay in bed for a long time, and long-term bed rest can induce the following problems. 1. Being bedridden for a long time is prone to fatal pneumonia. Sputum and other tissue secretions will not be discharged. Coupled with the reduced resistance of the elderly, it is easy to cause stubborn and persistent lung infections over time. 2. Venous thrombosis can kill people in minutes. The veins of the lower limbs lose the squeeze of the calf muscles, and it is easy to form thrombosis. Once the blood clots fall off, they will scurry along the blood vessels, possibly blocking vital organs such as the lungs, and can kill people in minutes. 3. Pressure sores and urinary system infections are also terrible. The skin on the back is squeezed and is prone to ischemia, and pressure sores will follow. It can also cause urine to be retained in the urinary system, causing urinary tract infection. 4. Bone mass will become more porous. The amount of bone lost by the elderly after being bedridden for a week is equivalent to the amount lost in a normal year. Over time, even if you don't get out of bed and walk, a simple turning over or a few coughs can lead to fractures. Although a fall occurs in an instant, the conditions that cause it develop over a long period of time. Elderly friends are reminded to take strict precautions at the following 4 moments to avoid falls. 1. When getting up. After opening your eyes, lie on the bed for 1 minute, then slowly sit up, slowly put your feet on the ground, slowly stand up and start walking for 3 to 5 minutes. This can prevent cerebral ischemia caused a fall. 2. When getting up at night. Install a night light next to the bed, clear the debris from the aisle in the room, and put a non-slip mat and handrails in the bathroom. 3. When taking a bath. The bath should not exceed 15 minutes, and the bathroom door should not be locked. You can bring a small non-slip bench to save energy while sitting down to wash. The bathroom floor should be made of non-slip tiles, and anti-slip mats should be laid. Try to install handrails or fixtures. 4. When waiting for the bus. Suggestion: it is best to carry a folding crutch with a bench when you go out. Do not sit or stand all the time while waiting. It is recommended that when you fall, support the ground with your hands. The injury is often to the wrist joint, which may at most lead to a fracture of the distal end of the ulna or the distal radius. There is no need to stay in bed for nursing care. Rehabilitation training is easy to do, and fatal complications will not occur. It is not recommended to fall landing on the buttocks. The support point falls on the buttocks, which can easily lead to femoral head fractures, lumbar compression fractures, hip joint fractures, and femoral neck fractures. If not treated in time, it may cause life-threatening complications such as pneumonia, bed sores, urinary tract infections, joint contractures, and blood clots.